Hello, you're watching the Physio channel, and in this video we're going to treat a real patient who's presented with some lower back pain and thoracic stiffness. We have here with us a 39-year-old male who has an office job and also runs a farm. And as I say, they've reported with lower back pain and what they describe as some stiffness in their thoracic spine and just feeling that their posture could be improved, or at least their movement could be a little bit more flexible and mobile. So we've done some assessment already, and on the screen here I'll just pop a series of red flag questions which we've asked to do with the lower spine and the spine in general, and it's always important to ask these screening questions before proceeding with any further assessment or further treatment. Now, we've also asked about the aggravating factors and the easing factors. So the aggravating factors were described as long days in the office in a seated position, but also getting some aggravation when he's lifting on the farm as well. As for the easing factors, they're actually quite limited to just resting, lying on his back, and after a good night's sleep it feels a little bit better. So there's definitely potential there to improve those with some more rehabilitation strategies. Now, to begin with, the physical assessment, when I'm dealing with the spine, once we've gone through the subjective questioning, I usually like to start by checking for any midline tenderness, which means just applying a posterior to anterior force down through the spine, through the spinous processes, and just asking if there's any discomfort or pain or sharp pain, and also looking for any reflexive muscle contraction as well, which indicates that you may have come across and be pressing on a painful area. Now, it's quite common to have midline tenderness, but we're looking for anything that's specific and anything which causes sharp pain, and that might indicate a more specific spinal injury, which would be unusual unless there was a history of trauma, such as falling out of a tree, for example. Working on a farm, that's something that can happen, or falling onto your back, or falling onto a hard surface or a rock. All of those things I've seen in patients in the past. So here there seems to be no midline tenderness coming up from the lumbar up here to the thoracic spine, so that's brilliant. Next, we're going to have a look at some active range of motion. So from a seated position, if we start with the thoracic spine, we'll ask our patient to bend forwards into flexion and to slump forwards, dropping the head down and really just trying to slump and flex through the thoracic spine there, and ask how that feels. So the description was that the position feels comfortable, but there's a little bit of sharp pain around this mid-thoracic level. Let's go in the reverse position now, so through neutral and then into extension. Okay, sometimes you get the patient just to put their hands behind their head, just to hold the weight of your head, and then that usually lets you extend a bit further. How does that feel?
It feels good until I move forward and I realise I need to stretch more of the muscles in my back.
Okay, good description, thank you. Next we'll have rotation, so cross the arms in front of you, just place your hands over your shoulders, and let's rotate first to your left. It's good to do rotation in a seated position because it locks out the lower body and focuses the rotation on the spine. We then go rotating across to the right, and with all of these movements we're looking for range of motion, the willingness to do the movement, and also asking about any pain reporting through or at the end of each position as well. Now, arms by your side and relaxed. Place one hand up onto your head and side flex in the opposite position. Side flexion left, and then switch hands, hand behind your head. Great, and side flexion right. Okay, brilliant. Both of those look like good movements. Any discomfort with those side to side?
Same position.
Okay, pain in this mid-thoracic with both side flexions. So there's certainly something going on here which needs some attention as well. Now we're looking at the lumbar spine as well as the thoracic spine, so we're going to do some more lumbar related movements now. Next we'll do some simple active range of motion for the lumbar spine. So firstly, if you can flex forwards towards your toes, touching your toes if you can. But here we're more interested in what's going on at the lumbar spine. Is there a good amount of flexion? Next, coming up, going back into extension, leaning back. Naturally there's less extension available, but it's still a movement that's good to test the patients with. Good, coming back, okay. We've done a bit of twisting already, but we'll do that again for the lumbar spine. So twisting around to your right, trying to keep the pelvis still, and twisting around to your left, once again trying to keep the pelvis facing forwards. Great. Next, side bending to the left, running the hand down the side of the leg, which gives you an indication of how far they can go, and then running the hand down the right side as they side flex to the right, again seeing how far they can go. Looking for any reports of pain or signs of pain, the willingness to do the movement, and the range of motion as well. So that completes a quick active range of motion assessment for the thoracic and the lumbar spine. Next, we need to work out what our treatment plan is going to be and get started with that. Alright, so we've had a look at our assessment information and now we're going to start some treatment. So to begin with, we're going to do some soft tissue work down over the spine, over the thoracic area, and down into the lumbar region as well. I'm going to start with just some simple hands-on manual therapy, popping a little bit of wax onto the back there, and there we go, so I can glide over the skin nicely. And I'm going to use the backs of my fingers there, backs of my knuckles, in order to move down over the erector spinae. So keep your fingers over your thenar eminence like that as you're delivering the treatment, rather than forming a knuckle like this. It will make it easier for you and more comfortable for your patient. So applying a moderate to firm pressure and moving slowly down over the erector spinae. Sometimes I like to start at the bottom and work up, but it's so much easier if you're doing both sides to start at the top and work down, just as long as the patient doesn't have too long a back and you've got long enough arms. You've got somewhat of a mechanical advantage to work here over the thoracic region and then down over the lumbar spine. Your arms can stretch out and you can use your body weight to lean into that lumbar curvature. It makes things nice and easy for you as well. If we're trying to relax the patient and reduce muscle tone, we want to move slowly through the soft tissue so that we don't stimulate the nervous system too much and cause more of a stimulatory and upregulatory and muscle tightening type of effect, which might happen if we were to be too rapid with our treatments. That would be more akin to a pre-event massage rather than a post-event massage. So with all of this chat that I'm giving you, I better make sure I'm focusing on the treatment and check in with the patient to make sure that it's all okay. Is it all alright?
Feels very comfortable.
Good. Okay, excellent. Alright, so that's some good treatment down there over the erector spinae, and we could do some more of that, but I want to introduce some different things now. So let's have a look what we've got here. Okay, first of all, we're going to use a RockBlade to deliver some IASTM, instrument assisted soft tissue massage. So we're going to use the flatter edge of the tool there to go down over one side initially, and the smooth beveled edge of the tool will glide nicely over the soft tissue, and I want to try and maintain a similar depth and similar speed to what we were doing with the hands-on treatment. And this will feel a little different than the hands-on, and it can also give us a bit of a mechanical advantage, as the firmer tool might help to get a bit more depth into the soft tissue if that's what you were looking for. It's really important we move slowly there so we don't stimulate the nervous system and cause an increase in muscle tone. We're looking to try and reduce muscle tone so that in a moment when we do some mobility work and some stretching, we're going to get more out of it and it's going to be more easily achieved if the muscle tone has been reduced with some of this soft tissue therapy. Alright, so we've gone down both sides there. Okay. Now I want to get the patient moving a little bit and moving into flexion, so let's see what we can do. If you can sit up for me please, facing the wall, sitting in that midsection of the couch there. So the next thing we're going to do is a bit more soft tissue work. This time, rather than pushing, we're going to be pulling and lifting the soft tissue and then mobilising it. So to achieve that, we need a vacuum. We're going to use one of these cups here, or one of these RockPods. It's one of the extra large red RockPods. And place that over the lumbar spine, like so. Okay, and then I'll place one on the opposite side, like so. Okay, So they're firmly fixed onto the skin there. Now rather than just leaving them there, which wouldn't really achieve much, I'm going to hold onto them and mobilise the soft tissue around in circles, right up to tissue resistance. So I go up as far as I can, all the way out laterally, down to the inferior, and then in medially, mobilising the soft tissue as far as I can. Okay? Then I might switch direction and go the other way. And this should just feel like a nice deep massage without the associated pressure of using the hands or using the tools, for example. All right? Take those off there. Okay? Don't leave them on for too long. That will help you avoid any excessive marking. As you can see there, the marking is minimal and it's starting to fade as I'm talking. And as you're looking at it, you can see that they faded off quite nicely now. So he's not going to be left with marks there for many days to come. And that's because we didn't use too much vacuum and we only left them on for about 30 seconds. Next, let's move them up a little higher. And this time, we'll get our patient moving rather than moving the pods. Okay. Right, so what I want you to do now, hands on your knees and drop your head and try and slump and bend forwards as far as you can, and then really feel the stretch through your back, which is typically enhanced by the pull on the skin from the pods. Okay, and come back up again. Brilliant. And just repeat that 2 more times, moving forwards into flexion slowly, and really getting a good feel for that stretch as you drop forwards. Okay, so we're just doing a few repetitions, instructing the patient to do the movement and not leaving the pods on for too long. So we'll let him just do 1 more repetition and then we'll take the pods away so that we're not left with any excessive marking on the skin. The marking's not a bad thing in terms of tissue integrity and physiology, but aesthetically, most people would usually prefer not to be left with markings which last for days on end. And you can achieve that by not leaving them on for too long. Okay, so there's a little bit of marking there, but as you look at the screen, as you watch and as I'm talking, you'll see that starts to fade very quickly. You can see those lower ones have already faded very quickly already. Okay, bending forwards. Same thing, encourage the patient to flex forwards slowly as you run down their back using the RockBlade to perform some of that instrument-assisted soft tissue mobilization. Okay, so we could do a few of those. I'm sure many of you have seen or used these massage guns. I've got here the Flow Pro from Flow Sports Tech, and this is the largest device that they do. So we're going to have a try of this now on our patient. Just going to put it on the lowest setting. I've got one of these softer end inserts on there, so it's got a bit of foam to it, so a bit of extra give, and I can then try that on their lower back. I've done a couple of things here. Firstly, I haven't pushed the tool into their back because that would likely cause discomfort. So I'm just using very light pressure. The other thing I'm doing is I've angled the tool to about 45 degrees rather than having it at 90 degrees or perpendicular and straight into the patient's back. That means it's firing straight into the muscle, and that can cause, again, too much sensory overload and essentially discomfort or pain. By angling it at 45 degrees, typically makes it much more comfortable for the patient. I'm going to run that all the way up over the erector spinae. And obviously we don't want to put it over the center of the spine. You can get, and Flow, it does come with an attachment with like a 2-pronged attachment, so it's bifurcated, and therefore you can run that over each side of the spine. But that attachment is quite a firm one, so it can be a bit uncomfortable if it's pushing into the soft tissue. And I prefer to use one of the softer ends on the tool, as it's more likely that most patients will get along with that. There's less patients will get on well with the firmer ends, but most patients will be very accepting or very receptive to using one of the foam soft ends on the Flow. So our patient's sitting still there, so we could just encourage our patient to flex forward again, slowly as we deliver the treatment. And if we combine the passive input with the active movement, that's a great stepping stone towards some more self-directed rehabilitation, which we can look at later. One of the benefits of using these massage guns is that they can be used over clothing, and sometimes it's more beneficial to use them over clothing because the clothing provides a bit of extra absorption for the percussion, and that can make it a bit more comfortable for the patient as well if they have got some sensitivity around there. So if you're in a rush or the patient doesn't want to undress or it's cold or many different scenarios, then using the tool over the clothing can be a great way of delivering some rapid passive manual therapy and getting some quick results as well. So yeah, we've done a few things there. Now, what's next? In this next section, we're going to have a look at some mobilization and manipulation. One of the easiest areas to mobilize and manipulate on the spine is the thoracic spine. It's a pretty sturdy area due to the rib cage, and it's usually very responsive to some manipulation treatment because this area can often stiffen up, once again because of the rib cage, but also it tends to get stiff if people have been sitting for a long time, as the normal natural movement doesn't occur and is restricted by the back of the chair and just general lack of movement. So thoracic stiffness is very common and is often responsive to mobilization and manipulation. In particular, a PA, or posterior to anterior. And one of the most common ones is a direct pressure down over the thoracic spine. So we've done a bit of this already by way of assessment, but if I place my hands each side of the thoracic spine over that mid area there, and just do a bit of mobilizing, just to get a bit of feedback from the spine so I can feel that it's feeling quite mobile here. I feel that it's probably going to be responsive to a manipulation, but I need to just check with my patient. How's that feel?
Comfortable.
Okay. It feels comfortable. As we looked at earlier, there's no red flags, so I'm going to go ahead here and do a thoracic manipulation. So I'm going to ask you to breathe in. Good. Breathe out. Keep breathing out. Let all the air out your lungs. I'll follow you down, and then so 3 thrusts, then we've got a little bit of cavitation. It's not always about the cavitation, of course. It's just about putting the spine through that range of motion and potentially getting a transient increase in range and reduction in pain. So that was pretty successful there. It felt quite springy to me, so it didn't feel as restricted as I thought it might do. So I'm going to go ahead now and just mobilize without actually doing the manipulation. So I'm not going to be putting in that rapid, low amplitude, high velocity thrust, the HVLA. I'm just going to be mobilizing here up to the end of range, and it's all feeling okay. So I'm going to now proceed to do another technique which stretches the thoracic spine into extension and again provides that posterior anterior mobilization. So it's an alternative to the one we've just done here, and it's done in the supine position as opposed to this one in the prone position. Okay, so now we have the supine PA for the thoracic spine, and in addition the patient's going to have some extension through the thoracic spine, or added extension, because they're going to be lying back over my hand. So I've tucked my knuckles in and kept my index finger and my thumb out, so you're in this kind of pistol grip position. And this technique is also known as the dog, because apparently when it was being demonstrated to a group at a conference, somebody shouted out, "Sir, I wouldn't do that to my dog." Not to worry the patient. You ready?
Yeah.
So, breathing in. Good, slump forward. And relax, just lie right back over my hand. And up. Okay, there we go. Simple as that. Next, we're going to do some mobilization for the lumbar spine. So whereas with the thoracic spine, we tend to go towards looking at either flexion or extension. Usually extension is a movement which is restricted and responds well to mobilization. On the lumbar spine, due to the shape of the lumbar spine and due to the arrangement of the facet joints, the lumbar spine typically responds best to rotation. And after that, I would say probably arguably flexion. But rotation is often a go-to when it comes to stiffness in the lumbar spine. So I'll put my patient onto the side here, and I will pull their lower leg, so that's straight. and then ask them to bend the top leg up with the foot just hooked behind the leg there, just straightening that lower leg again. Then if you hold your wrists like so, okay, patient holds their wrists like so, that leaves a little gap through their arm, and then you can come through that gap and that's your upper body lock just here, okay, there, and then placing the hand on the back. So I'm going to push his shoulders back so they rotate towards you, and at the same time use my forearm to bring the pelvis towards me, and that is then putting them into a progressive rotation position. And for your mobilization, well, you've already done your mobilization right here, and you can take them up to end of range. So for manipulation, we go up to the end of range. Usually advisable just to back off from that end of range a little bit. And then we do that HVLA, high velocity, low amplitude thrust. So breathing in normally, relax and breathe out. There we go. Okay. Have a go at doing that on the other side. Alright, so to finish off, if you remember at the beginning the patient made a comment about posture and wanting to improve their posture. So I'm going to finish off with some posture taping over the thoracic spine and then send the patient away with some home exercises. So first of all, we've been using a bit of wax on the back, which is not too difficult to remove, it's much easier than oil, but still I've got some cleaning wipes here. I'm just going to quickly wipe off some of that. So I'm going to use some of the bright neon rock tape, kinesiology tape, to place over Andrew's upper back here to act as a postural cue and a postural reminder. So from the top of the shoulder around the AC joint, I'm going to go down underneath the opposite shoulder blade. To make sure the tape stays in place, I'm going to round off the ends of the tape so those edges don't catch on clothing, and the tape's then likely to endure for a little bit longer. So there we go, 2 pieces of equal length with the ends rounded off. Tear the backing paper. By stretching it, the backing paper will tear, the tape will stretch. Peel away the backing paper without touching the glue side and pop that over the shoulder like so. Rub the tape to make sure it's stuck down and secure on the skin, and then we'll repeat that on the other side. Okay. Now we need to put the patient into the position that we want them to be into, or the position that they feel is comfortable. So if you can hold yourself in a comfortable position there, great, and then I'll peel away the backing paper. Add a small amount of stretch to the tape as it crosses over the spine and underneath the opposite shoulder blade. Okay, so there's a small amount of stretch here, no stretch at either end. Rub the tape to make sure that it sticks down onto the skin, especially in the crease of the spine there, making sure we've got everything firmly stuck down. Other side, patient's in their desired position again. No stretch on the last bit. Rub to stick. Now what we don't want the tape to do is to force the patient into a fixed posture or an awkward posture or an uncomfortable position. What we do want the tape to do is just give a little bit of skin pull, a bit of postural reminding, a postural cueing, so when they do bend forwards a bit and when they do slump forwards, the tape pulls on the skin, they feel it, they remember why it's there, and they make their own conscious effort then to change their position. So they're not sitting in a prolonged flex position all day in the office, and they try and, well, sit up a little bit straighter, but hopefully be a little bit better if when they felt the tape they thought, oh yes, I've got to do my exercises, I've got to do my extensions, I've got to do my rotations, I've got to get up every 20 minutes, half an hour, every hour or so, I've got to get up and do my rehab exercises. So it's not just about sitting people up straight, it's about reminding them to move more and to engage in the other rehabilitation things that you may have taught them. Okay, so to finish off, we've got to do some home exercises for this patient so they've got some rehab strategies to work on. But that's it for this video. Thanks for watching. Please subscribe and we look forward to seeing you in the next one.